My name is Lynn Kersey. I'm the Executive Director of Maternal and Child Health Access, and with me is Monica Ochoa, the Oral Health Advocacy Coordinator for MCH Access. We're really happy to be here and to have you all here today. This has been quite an undertaking for us, and we're hoping that you enjoy it, that you learn a lot, that you stay till the end of the day for our policy and advocacy recommendations and work, and that you join us in that work and in the months ahead. There's a lot to do. We're happy you're here to learn about it. Today's agenda is filled with speakers and resources and handouts and all kinds of things that you'll be able to take back with you and share with your colleagues as well. A lot of this will be on our website after the conference, and you'll hear about, but we do also want to advertise our Los Angeles County stakeholder meetings for dental oral health, which are held about every other month, and you'll get on the list for that if you'd like to be. So we'll go ahead and get started. I want to introduce Tina Kim from the Community Clinic Association, who's going to be our moderator today. Our conference today is held in conjunction with our partners, Community Clinic Association of Los Angeles County. So we're happy to be here. Thank you.
All right, good morning, everyone. Oh, you got your coffee and your sustenance and everything. Good morning, everyone. Good morning. All right. So again, my name is Tina Kim. I'm with the Community Clinic Association of Los Angeles County. We have had the privilege of partnering with Maternal and Child Health Access on this very important project, and I will be your MC for today's conference. Maternal and Child Health Access and Community Clinic Association of Los Angeles County would like to acknowledge and thank those who have sponsored us and helped us make this event possible. So our sponsors are LA Care, Health Plan, March of Dimes, California Community Foundation, HealthNet, and DentaQuest. Our vendors, many of which are actually exhibiting outside, Henry Schein, Group Practice Solutions, and Patterson Dental. So thank you very much. A very special recognition to First 5 LA for funding our project. And our planning committee. For those of you that were participating in our planning committee, could you please stand up so that we can recognize your work and your contribution to this event? Round of applause. Thank you. And last but not least, the California Department of Healthcare Services, the Medi-Cal Dental Division, for attending today's event. So thank you very much, and a round of applause to them. So I'm going to turn the mic over to Monica, who is going to walk you through the materials in your packet, and then I'm going to come back to talk to you about some housekeeping.
Good morning. I'm going to go through the packet so that we all know what's in our packet. So this is the participant handout. And the first thing that we have in there is the agenda, which you will be very clearly marked. Then we have an order form for Get Dental during pregnancy for you and your baby posters that you will all be receiving, but we have an order form here in case you would like to order more of these. And we also have two 8.5 by 11 English and Spanish posters that you can also put at your clinics or agencies as you wish. And then we have the perinatal oral health recommendations that we'll be referring to during our presentation. And at the very end on that left side of the packet, we have biographies. We have all the speakers and the planners' biographies. And on the right side of the folder, we have a Get Dental Care During Pregnancy for You and Your Baby brochure. And this brochure was really intended for pregnant women so that they can be informed and advocate on their behalf in case they meet a provider who is unwilling to treat them. Then we have another trifold that is titled Ensuring All Pregnant Women Access Dental Benefits. And this is an action plan that you're going to be working on. And we also have some oral health guidelines. Oral health during pregnancy and early childhood, evidence-based guidelines for health professionals. And last but not least, the thing that we all love is our evaluation. All right. Okay. We have a short little video that encapsulates our project that we'd like for you all to view at this point.
I've been doing research on the internet and I came across MCHAccess.org. I'm about 4.5 months pregnant and I'm in severe pain on my lower jaw. I know there's something going on in my molars, and I've noticed that you're like a coordinator for an advocacy to help pregnant women with their dental issues. I was just seeing if you can help me or guide me and see where I can get treated or see a dentist. I've been calling around a few dentists and they don't want to see me. They say that Medi-Cal doesn't cover. But I read a lot of blogging where it says that Medi-Cal has changed, that they do cover pregnant women.
They explained to me when I came here for my very first prenatal checkup that I would have dental benefits along with medical benefits for my baby.
Through our work, we see many barriers. For example, women having a hard time accessing dental providers because their prenatal providers may tell them that they cannot seek dental care. Pregnant women themselves being fearful of having x-rays taken during their pregnancy, and just providers overall not knowing that pregnant women have dental benefits. Something as simple as a poster can speak volumes in terms of the education and awareness it can convey at a prenatal visit. Maternal and Child Health Access is working on the integration of perinatal care and oral health care.
I hope you hear my message and you call me back at your earliest convenience. Thank you.
Without further ado, I'd love to introduce back up here Lynn and Monica. So Lynn actually is the founder and now executive director of Maternal and Child Health Access. She was a founder, she founded this great organization in 1996. Maternal and Child Health Access, MCHA for short, assists pregnant and postpartum women and their families in downtown Los Angeles. They have 7 different programs that are just so critical in the community. And prior to that time, Lynn directed a similar program for Children's Advocacy Institute and Homeless Healthcare Los Angeles, and was the first coordinator in Los Angeles for health access. And so Lynn will be coming up to share a little bit about our project. And Monica is the Oral Health Access Advocacy Coordinator at Maternal and Child Health Access, where she is responsible for increasing access and utilization for oral health care services for pregnant women and children 0 to 5. Through this project, Ms. Ochoa has educated and informed countless pregnant women, families, providers, and social service agencies on the importance and need for oral health care and dental benefits available for pregnant women eligible in Medi-Cal. So I would like to invite them both up here.
Good morning again. This is just background, and we can skip a lot of it. You've heard it, but we have grown from a very small program in 1996 to over 50 people now who work in various programs that touch the lives of pregnant women. And all of this work with families and pregnant women informs our advocacy work. It's how we know about what's going on and what needs to be changed. If we change things for one person, that's nice and that helps them, but we need to move on and make sure that these systemic issues are being addressed at the policy level. So a little bit of background. The first specific oral health benefits for pregnant women came about in 2001 and were for 4 of the most used aid codes, if you know Medi-Cal, for pregnancy. And that was expanded in 2005 to cover all pregnant women in Medi-Cal, in any aid code in which pregnant women might be found. So women who got CalWORKs, women who may have had Medi-Cal already but then got pregnant, could then enjoy the benefits of dental care covered under Medi-Cal, which improved the reach of the services, but it made data gathering more challenging because we had to find those pregnant women within Medi-Cal aid codes. Because the benefits for dental care are now in minor consent Medi-Cal, for teens, disability aid codes, temporary aid codes that cover pregnancy like PE, and so it's a bit of a challenge, and we'll talk about that a little bit later. Through the benefit of increased research, some of which you can find on our website, and initial funding from the UniHealth Foundation and the California Hospital Medical Center Community Benefits Program, we started looking at making sure that dentists and pregnant women knew about the benefits that were in Denti-Cal. The Consensus Conference in New York and in California in 2010 helped publicize and pave the way for awareness that it was not only okay to to see a dentist during pregnancy, but recommended. And then in 2009, we got actual funding for advocacy from First Five, which I'm not sure if anyone's here from First Five today, but I have to celebrate them and point that out, that they really are unique in funding advocacy and saying, yes, we do need to advocate. We need to affect policy. The Oral Health Advocacy Project is multifaceted. Monica will go into more of this, but we've surveyed dental providers, we've done site visits at clinics, created posters and materials, which you're seeing. We provide technical assistance, so providers can call, women can call. The voiceover that you heard on that video was an actual client, an actual real pregnant woman calling and saying all those things. I'm in pain. The dentists say they can't see me. They say there are no dental benefits. And I know from your website that there are. So that just seemed to us to be perfect to encapsulate why this project is needed. And at the end saying, I hope you will hear me. And I hope we will hear pregnant women today and help identify barriers and solutions and work on policy at the state and local levels. Thank you.
Hi, my name is Monica Ochoa, and I am the Oral Health Advocacy Coordinator at Maternal and Child Health Access. In 2011, one of the first projects that we did was a survey that was mailed to over 1,600 Denti-Cal providers. The survey was mailed to really get an idea of barriers that were existing at the provider level, to find out if they even knew that pregnant women had benefits, and to also let them know about the CDA ACOG guidelines. These guidelines recommend that any oral health treatment, including needed x-rays, are highly beneficial and can be undertaken during pregnancy with no risk when compared to the risk of not providing care. Our partners in this project are the Community Clinic Association of Los Angeles County, CCALAC, the regional association representing 53 community and free clinics that operate nearly 200 clinical sites and serve nearly 1 million patients every year. 59% of the clinic's patients are uninsured, and 85% are below the 200 federal poverty level. With our partners, we have focused on site visits to hear how women are informed about oral health during pregnancy and about possible barriers to care. We have also participated in all of the clinician roundtables and shared information about dental benefits to pregnant women. This anecdote illustrates the power of our poster that was developed with funding under California Hospital Medical Center and continued by First Five LA. One day, I received a call from a pregnant woman on Medi-Cal, who asked me if there were dental benefits during pregnancy. I responded with yes, of course. She had been at a clinic and while in a waiting room, asked a healthcare worker if there were benefits for pregnant women and was told that Medi-Cal had eliminated all benefits for adults. She was then taken to a prenatal exam room and saw our poster that said, "Get dental care for you and your baby." Needless to say, she was confused. This poster really serves to educate both pregnant women, and it also serves as a reminder for staff to let pregnant women know that they have dental benefits as well. A little bit about the technical assistance that I do. On a weekly basis, I get about 1 to 5 calls from pregnant women needing help with finding a provider. And I also service clients who are part of other MCHA programs, such as health insurance, perinatal case management, Welcome Baby, a home visitation program, CalFresh food stamps, etc. Imagine you are pregnant and in pain from a hole in your tooth that causes you headaches so severe that you take medication to relieve the pain even though you are not sure you should. Imagine that you are pregnant, poor, 18 years old and with 6 cavities that need filling, and your dentist tells you she can only fill 3. Imagine being pregnant and your level of pain being a 10 due to an abscess. You visit a dental clinic and they give you antibiotics and ask you to come back in a week. However, you can't take the pain, so you visit someone who is not a licensed dental provider and performs a root canal. These are all true scenarios from pregnant women that we see. The calls that I get are from women who are savvy enough to search on the internet and find our program, or lucky enough to come into contact with someone who lets them know about maternal and child health access. I often think about the women that are not as savvy and go through their pregnancy in pain and never find an agency to help or inform or advocate about dental benefits. The barriers and issues brought up in these stories are really the basis of our work that serve to advance improved policies for oral health access. Advocating on behalf of low-income pregnant women is our main goal. This is done through several avenues. In 2012, Maternal and Child Health Access and the Community Clinic Association of Los Angeles County testified at an Assembly Budget Subcommittee on Health and Human Services hearing, convened by then Assemblymember Holly Mitchell. MCHA and CCALAC participated on a panel that provided basic information about children's access to dental care in Los Angeles, how and where children receive dental care, and issues with managed dental care in Los Angeles, one of 2 counties with managed care. We are also active members of the LA Stakeholder Process, a work group convening largely brought out because of media attention to low utilization of dental care in Denti-Cal. We help bring about media attention in Los Angeles County with our work to highlight children's access to care. The work group identifies issues in the Medi-Cal dental program. Maternal and Child Health Access has successfully advocated that the oral health of pregnant women be addressed in these convenings. Maternal and Child Health Access also continuously reviews provider bulletins and comments on drafts addressing benefits for pregnant and postpartum women. I'm going to go through these barriers quickly because I've already got the 15-minute warning sign. And they will be addressed a little bit more by our speaker, but these barriers are ones that we see firsthand through our technical assistance. Dental providers are afraid to treat pregnant women, and they'll often ask them to come back after the pregnancy for treatment. Providers feel that treatment may harm the baby or is not safe to undertake during pregnancy, such as radiation from x-rays. Most dentists will not treat without a referral form from a prenatal provider. Elimination of most Denti-Cal benefits in 2009 caused confusion about covered benefits for pregnant women. And the message that most providers heard was that all adult benefits were eliminated. Prenatal providers may not always inform women that they have dental coverage with their Medi-Cal benefits. Lack of an online Denti-Cal directory that lists providers willing to treat pregnant women is also a systemic barrier. Billing barriers also deter providers from treating pregnant women. Data. What do we know about the numbers of low-income pregnant women in Los Angeles who access services during pregnancy? We know that over half the births in Los Angeles County are covered through Medi-Cal. We know that pregnant women fall in the 0 to 3 age range, the group with the lowest utilization rate. We've been able to obtain some data that tells us how many women visit or utilize dental benefits during pregnancy. Again, this is made more difficult by how pregnant women are identified, or better yet, not identified on the Denti-Cal data. Early data for 2009, prior to our advocacy project, for all users who might be pregnant, hovered around 3%, which climbed to 5.5% in 2011. 2012 data for Los Angeles County, measured differently, just looking at the main pregnancy aid codes, showed that we have a utilization of 11.7%. This figure represents pregnant women in 17 pregnancy-only aid codes, ages 21 through 49, who used both medical and dental services during pregnancy, and who accessed care through private providers or at federally qualified health centers. So in other words, of all the women eligible for Medi-Cal, only 11.7% of those in pregnancy aid codes are accessing oral health benefits. This is all we know. We don't have any other reportable data for pregnant women in other family aid codes. It is simply not tracked or quantified. On the claim form, there is a box that allows for comments. Providers are instructed to check this box and indicate pregnant to process the claim for pregnancy benefits. Providers, however, claim that this comment box is not very reliable, and the written-in information is not quantified or tracked. So we really have no idea how many providers check this box and the numbers of claims that get reimbursed. This limited information leaves us with a lot of questions, especially this one. If we don't know our data well, how can we effectively advocate? Our recommendations. Through our work and our experience, we've made some recommendations. You have these in your handouts. At the prenatal level, we recommend that prenatal providers inform and educate pregnant women about the availability and importance of dental benefits. For dental providers, we recommend that you are knowledgeable about the benefits available to pregnant women. For CPSP providers, health educators, and home visitors, we recommend that you inform all pregnant women of dental benefits through Medi-Cal and assist them in finding a dental provider. Recommendations at the policy level. We ask that providers who are willing to treat pregnant women be identified in the provider directory. Have a dedicated section in the provider bulletins on services to pregnant women that includes coverage, safety of, importance, and latest utilization data for all aid codes. Improve access to benefits for conditions that would complicate the pregnancy. And I'll come right back to that. When benefits are restored in May, posterior root canals will not be covered, a benefit that is imperative for a pregnant woman's nutrition. Claim form that quantifies the number of pregnant women who utilize dental benefits. Okay, I'm going to go back to conditions that would complicate the pregnancy. Conditions that complicate the pregnancy is wording on the Deni-Cal provider bulletins that addresses those situations in which non-covered benefits and treatments are critical and necessary. Specifically, this means if a pregnant woman's oral health is left, this means if a pregnant woman's oral health is in a situation where, if left untreated, can result in a condition that would complicate the pregnancy, providers are requested to do the following. 1, submit and receive a denial for a procedure not on the list of covered benefits. 2, submit a claim inquiry form with documentation supporting the treatment, that the treatment was critical and necessary to prevent a condition that would complicate the pregnancy. Document that all other covered treatment options are insufficient or contraindicated. Requests will be considered on a case-by-case basis. Our response to this is, this process is not fast enough for a critical and necessary situation. We've tried to go through this process several times with clients whose situation was extremely critical and were rejected every time. We have no data or information on the use of this process, total numbers, rejected claims, accepted claims, and types of claims. Of all the information that I've presented today, This is what I want you to walk away with. Assist all pregnant women with accessing oral health care benefits by sharing information from today's conference with staff at your agencies and with partner agencies. Implement the recommendations to help all pregnant women access oral health care. Report barriers and advocate on behalf of all low-income women seeking dental care during pregnancy, especially those who are in pain. Work with MCH Access on policy solutions, such as through stakeholder meetings and other meetings. Thank you. Any questions? Yes.
The question was the source for the data for utilization that we showed. That was, that's the State Department of Health Services, the dental department, the dental branch. I'm not sure if it's available online. We can, not at this time, but we can request that, definitely. As we said, we need to make sure that it's understood what it represents and the aid codes that are reported, because we have problems with the fact that women are just in regular Medi-Cal and they may be pregnant. So it's not the full range of pregnant women. We need to be sure we couch and represent what's actually being reported. Thank you.
I don't think there's a limit. I mean, the pregnant women are eligible for 17 preventive dental benefits. You know, I mean,
she couldn't get more than one cleaning, for example, but in different areas of quadrants of the mouth she could be. The question was, how many times could a woman be seen during her pregnancy? And it depends on the benefit. But there's certain numbers depending on the kind of benefit. Quadrants for teeth cleaning, for example, for deep cleaning. But would that answer your question? Is there something you think?
That's what I wanted to know, because when I refer patients, when I refer patients out, they usually see them once, and then I try to get them in postpartum.
Oh.
But it's very hard, you know, for those women to be seen after during postpartum. So I try to get them in before they're 6 weeks.
Okay, well, I'm sure Dr. Brown will be talking about that too.
Okay.
May be able to address your question in more detail. Thank you very much.
thank you.